Hello, Mr. Pfeiffer and fellow classmates. My name is Shanna Mena, and I am the Compliance Officer for Ashford University Hospital, or AU Hospital. Due to compliance having grown so dramatically in the last several years, I am in charge of many different areas in the hospital. I'm going to start my presentation by explaining what compliance is and how we depend on it for so many things in the healthcare world. I will then go into detail about some of the elements of compliance that I am in charge of at AU Hospital. Informed consent, patient safety, patient rights, and code of ethics are the four that I will go over today, and then we will conclude with my last words and references that I used to gain my additional information. Compliance is not just a job, it is a way of life for the healthcare world. Employees, staff, and patients depend on compliance, and we also depend on them to continue compliance. Once we have found something that works, why try to reinvent it? We need to learn from our mistakes so that we don't make them again. Using information and compliance elements from other hospitals and organizations can help us to maintain our compliance. We want to help each other as much as we want to help ourselves. According to Mimon, Schuchel, Sheikh, and Mimon, informed consent is the backbone of patients' autonomy, which is the right of patients to make decisions about their medical care without coercion by healthcare providers. The advancement in medical technology has further increased its importance. At our hospital, all physicians and staff are required to get permission from the patients before doing any type of procedure, exam, surgery, etc. Without the patient's permission, they are not allowed to move forward or talk to the patient. In certain situations, if the patient has a power of attorney, then we would talk to the advocate for their care. Respect for patients is an important element in our hospital. Patient safety is another important element that we ensure high-quality compliance in. We have an intense program that gets everyone involved in order to continue to take care of our patients and keep them safe. We have initiated a patient safety report that all staff are able to access and fill out at any time that there is an error or safety concern. All the information is anonymous so that they don't feel as if they are telling on their coworkers, but they are still reporting the problem. According to Howell, a patient safety culture should be non-punitive and emphasize accountability, excellence, honesty, integrity, and mutual respect, which I believe we have achieved here at AU Hospital. We then have a team that goes and investigates the issues and comes up with a solution on how to prevent them in the future. The staff wins prizes for the department with the most good catches and preventable reports, which builds morale and keeps the program running with everyone involved. Patients' rights have become so much more than the right to privacy and confidentiality. Do not resuscitate orders, DNRs, are also a patient's right, but according to Griffith, there have been more controversy over DNRs because families weren't aware that there was an order in place until it was too late and they felt as if they didn't have a say. But the patient right is the right to have a DNR, not that they have to inform the family. That is a whole other issue that the family has to work through. Euthanasia and physician-assisted suicides have grown and are more used nowadays. Some people have the humanistic desire to end their suffering and pain and are given the opportunity to ask the physician to help them in that process. According to Levy, Azar, Huberfeld, Siegel, and Strauss, the psychiatrists and other physicians, it all depends on the situation of the patient and how they react to euthanasia or physician-assisted suicide. Here at AU Hospital, we respect and support physician-assisted suicide, but not euthanasia. There are very specific guidelines to physician-assisted suicide and lots of paperwork and family involvement as well. Code of ethics are standards of practice that should be abided by all healthcare workers. The four principles of ethics that Bastillos talks about are autonomy, non-maleficence, beneficence, and justice. We follow these principles here at AU Hospital to ensure the care of the patient is ethical in all ways. If the patient requests to be left alone and doesn't want treatment, then we respect that request. We also will not do no harm to a patient because of any personal feeling we may have. A physician wants to do their best at their job and take care of the patient the best they can, but they have to follow the rules and rights and requests of the patient. That is why compliance is so important, because there are always things that can be improved on to make it better for the patients and the employees. Today I talked to you about what compliance is and how we use it at AU Hospital. Being the compliance officer, I don't just comply with the 4 elements that we talked about today. There are many more, and that is why my job is so important. We all work as a team here at UA Hospital, and all the employees here know how important compliance is, not only to the patients that we see, but also to them. Everyone wants to see a better and brighter tomorrow, and that all starts with what we do today. Thank you. This is a list of the references that I used in today's presentation.